Welcome back. You're watching As It Happens, and my guest this evening is the Health Minister, Dr. Aaron Motsoaledi. Now, Dr. Motsoaledi, one of the things you did today was to highlight, for example, some of the successes of our health system. You were talking about how we're providing treatment to the largest number of HIV-positive people. We have the biggest program in the world. But what, for you, are the major challenges facing our health system? You spoke, for example, about the burden that foreign nationals, the strain that having so many foreign nationals is actually putting, the strain is putting on our health system.
The key problems are actually for Vuyo. The issue of the burden of diseases will have been resolved if those four issues were not the problem. There are four. And I was stating that in changing the laws, we need to change the relationship in government structures on those four. It's the issue of human resources. It is quite problematic, and we're mentioning about it.
And what do you mean exactly? What do you mean exactly by that?
I mean the health workforce. How many people are hired? Who gets hired? In what position? Who are the CEOs of hospital? How many nurses we've got and doctors? How do you balance between the support staff and the clinical staff and the budgets thereof?
What is wrong with it at the moment? Is it, do we have fewer competent or qualified people? Is it the way those people are appointed? What exactly is wrong with it?
Well, the first thing in terms of numbers for you, Sub-Saharan Africa accounts for 80% of all infectious disease in the world, but it accounts only for 3% of the total health workforce. It has been declared by the World Health Organization as a crisis. So that in itself, for instance, the shortage of particular groups of specialists, etc. So that's the first thing. But in the institution themselves, yes, the appointment of wrong people in wrong places, and I think I've said this a number of times before, which caused a problem. And I said, I'm discussing this with provinces, but I don't know how to stop it because the authority to make those appointments lies with them. I mean, one example I can give, which unfortunately is still going to the courts, and I've been blamed for saying it in public, but I said it because it was painful. The HOD of Northwest, he was working in my department as a director, and he was not coping with a directorate. So when I heard that he's about to be appointed a head of department in Northwest, I had to approach the premier and said, but this is going to be disastrous. If this man cannot cope with a directorate, how is he going to cope with the whole province? You know? But I was not listened to. And there's no law or act which I could have used to stop that. I just pleaded. And I remember going 3 times to plead because I knew the consequences. So those are some of the issues.
So HR is the first.
About. Yes. The second one is financial management. People believe the budgets that go to provinces are determined by me. No. It used to be like that before, before when provinces were not political entities, before the National Health Act was enacted. It is the money moved directly from national treasury into the treasury of provinces. And DORA, Division of Revenue, says once money lent into a provincial treasury through equitable share, that province, the Executive Council, has got the sole right to decide what that money must be used for, in which area. But people believe it's from me, and I will have not budgeted very well for human resources. It's not like that. The third is procurement or supply chain. You know, how things are procured, how many of them, and from who. That also is the job in provinces. If it was not, Midwest will not have happened, because I will have seen immediately that this is wrong. But you discover it after it has happened. And I was saying, this is sort of like you are coming as a pathologist to do post-mortem all the time. The last one is maintenance of infrastructure and equipment. All those are provincial functions which they don't look health. They don't look like health because they are not clinical and all that. But believe you me, they are the ones who cause a crisis. And now when you add the burden of disease on top with that one, then you have got this very clear situation that is very troublesome.
Well, let's go through some of the factors that are relevant to this. One, as a member of the executive, you sit with your cabinet colleagues and you look at the problems confronting each and every ministry and department. If we were to take, for example, the issue of, the impact that foreign nationals have on our health system, it is something, have you had those discussions at cabinet level?
Oh, numerous times.
And what has been the outcome or the results of it? Is there anything that you're doing as members of the executive?
Yeah, look, Vuyo, is a very sensitive matter, On one hand, it sounds like xenophobic when you mention it. On the other hand, it's burdening the taxpayer in South Africa. You sort of giving to your neighbor what you don't even have in the first place. And now
that is what cabinet is supposed to be about. You meet behind closed doors,
yes,
and you have these open and frank discussions about what is hurting your portfolio, which eventually is going to reflect on you. Because when South Africans look at what is not being done, they say, Aaron Motsoaledi, we love him very much, but he's just not doing what we're expecting him to do now.
Indeed, I've heard that. The issue is about the migration policy of the country. That's what the cabinet is at. And I'm sure you might have heard that a committee was established, which was chaired by Minister Aaron when he was still in monitoring and evaluation, in which I belonged, the Minister of Home Affairs, police, the army, to discuss about the migration policy on South Africa, because lots of people have complained about it in housing, in education, etc. But in the interim, what we have done, we called the Director General of Home Affairs to present to the National Health Council exactly what is the legislative or policy issues that could help us.
Do you feel that you're winning? Do you feel that those conversations are taking you anywhere?
Well, the results have not yet been shown, because I can't say we're winning, because you need a final product. For instance, the Director General said we need to form a sort of a committee with him, and he has formed it with the Director General of Health, where they'll say, look, even if there's no migration policy, but the present rule or act provides for this, it can be sort of a relief, or the present policy, etc. So that is the work that is going on. But yes, we have not yet seen results. And I don't blame them. I don't blame them, Vuyo. Most of the people who come, for instance, are pregnant women. And to turn them back when they are, it's a very sensitive issue. It's not something that will be very easy. Yes, the migration policy will help, but believe you me, it's a very, very complex
But then what about the other factors? I mean, you've mentioned finance, you've mentioned HR, you've mentioned procurement. You have the Minister of Finance being part of cabinet. You have other ministers responsible for some of the state enterprises. What are the conversations like there? Do you feel that the issues that you are raising are in fact attended to?
Well, it's me who must attend to them by changing the laws. And
why are you not changing the laws then?
No, we are actually doing that. Next week, tomorrow, I'm presenting the NHI bill to the cabinet. And I said it needs a massive reorganization of the healthcare system. And part of that reorganizing is to change the laws that have caused those problems. And if you look at the white paper and the bill when it comes, it's going to say we need to amend 12 acts which govern health. Even the Law Reform Commission, as I said earlier, said, look, out of the 108 acts, 39 of them, if you have to improve the healthcare system, what about change? So we are in the process of that. For instance, one of the issues that is going to be in the act is these big teaching hospitals, which you know about, Chris Hani, Baragwanath, Charlotte Maclege, they are, they are national assets, and they've got to compete internationally with the best. But they fall under provinces, and they bring a situation where in the Faculty of Engineering, Faculty of Arts, Commerce, the Vice Chancellor talked to the national minister. But in the Faculty of Health, they've got to get what they want from the province. So we are asking that all those academic hospitals must be uplifted from provinces be taken to national level. It was so.
But were you asking, Minister, because you are you are a member, a senior one at that, of the governing party. You have a majority of MPs in Parliament who can actually, or whose job it is to actually make laws in this country. And this issue has been going on forever and ever, of the powers that you don't have and that you believe you should have. Is that being addressed? Is that being handled by the ANC?
That's what I'm saying. For instance, the issue of uplifting academic hospital, I took it to the ruling party in 2012.
And what's the attitude like?
It was discussed at the policy conference, and I showed them the reason, and they agreed. It
6 years later, you don't have anything to show for
I'm still saying it was approved in the Mangaung resolution. But we couldn't implement because there was no law or act on which this was based. And we said, because we are coming with a new law, the NHI Act, to reorganize the healthcare system of the country, let's put it as part of that, so that when we change things forever rather than being piecemeal, because that will be problematic. So yes, I agree, it took a long time. Remember, we had to come up with the white paper, public participation, and incorporate it. Now the white paper has been passed by a cabinet. Now we have developed the act. We have got to talk to state law advisors to see the constitutionality, and I can assure you, Vuyo, from August last year, we've been in meetings almost every week with the state law advisors. Change this, change that. And now we are ready. That's why tomorrow it's being submitted to cabinet. Can you approve this? Once they approve, it still goes for public participation and then to parliament. So the process of changing what is there in a law is not a very easy thing which you change because you are wishing to. It's quite a process, and that's what has bogged us down.
Minister, we have unfortunately run out of time. Thank you very much for talking to us, and best of luck to you.
Thank you very much.
Well, that was the Health Minister, Dr. Aaron Motsoaledi, and that brings us to the end of tonight's edition of As It Happens. My name is Vuyo Mvoko.